She's doing that. She's back to her herself. She's looking fine right now. Thank you, y'all. I appreciate that. I was so worried.
Good morning. Good morning and welcome to the citizens of Douglas County. Today is October 28th, 2024, and I am bringing this work session to order. Clerk, would you please call roll?
Yes, ma'am. Commissioner District 1, Henry Mitchell, is not present at the moment. I'm sorry. Commissioner District 2, Whitney Kenner-Jones.
Present.
Commissioner District 3, Martin Raxton.
Present.
Commissioner District 4, Vice Chair Mark Alcaraz.
Present.
Chairman Ramona Jackson-Jones.
Present. Thank you so much, Clerk. Board of Commissioners, do we have any amendments that need to be made to the agenda this morning?
No.
Okay. Being none, we'll move on to the next item. Clerk, you have the floor.
Yes, ma'am.
And as a reminder, just 1 minute, Clerk. As a reminder, each commissioner, please just remember that we only have 3 minutes to make remarks and 2 minutes for rebuttal today, okay? Clerk, you have the floor.
Yes, Chairman, you'll need to ask if there are any amendments to the agenda.
I did, but I
Oh,
needed to
I'm
call a
sorry.
motion. Do I need to call a motion on that?
Yes, ma'am.
Okay, if there are no amendments, Board of Commissioners, do we have a motion to accept the agenda as is?
Second.
We have a motion and a second on the floor. Any discussion, Board? We have a motion and a second on the floor. Please indicate by raising your right hand if you agree. We have a 4 unanimous vote and the motion carries to approve, and the agenda is approved. Clerk?
Okay, next we have public comment. So we did have 2 individuals to sign in, and I will just go over the procedures before you come up. When I call your name, please come to the podium and restate your name and your address and your subject matter. You'll have 3 minutes to address the board. The board is not here to answer questions at the moment, but if you have any questions, we can direct you to staff. So when I call your name again, just restate your name and address, and you'll have 3 minutes to address the board. The first individual who signed in is Susan Bowie. Did I pronounce that right? Bowie. Okay.
Good morning. Thank you.
Good morning.
Good
Let me
morning.
start by saying thank you for the opportunity to speak with you. And if you don't mind, I'm going to read what I wrote because I'm a little nervous, and if this were improv, I could handle it. But since it's not, we're going to stick to the script. Okay. My name is Susan Bowie. I live at 2935 Flowers Drive here in Douglasville, and I am here to talk about early voting. I am the leader of Sweetwater Indivisible here in Douglasville. I am also a post seat holder, and I am a statewide poll watcher. I'm here to address something that came to our attention over the weekend. This past Saturday, October the 26th, while early voting was taking place, Sheriff Pounds, who is on the ballot in Douglas County, hosted an annual trunk or treat event in the courthouse parking lot. While I understand that the community enjoys these events, I believe that a seasoned law enforcement officer should consider moving such a gathering to his own parking lot or to another location that doesn't already struggle with inadequate parking, if only for the sake of optics. I realize Sheriff Pounds has already won his election during the primary, but he's still on the ballot. We do not know if those running the event allowed people to wear shirts promoting candidates or to pass out campaign materials, or even if candidates passed out candy to the children while within the voting period and within the 150-foot limit. When I come here to vote, I often see others in the parking lot, and we usually nod and we move along. We just want to vote. I can't help but wonder how many people discussed voting while their kids were collecting candy. Were they within the 150-foot rule? How many voters drove by and chose not to vote because the lot was full and crowded with children? I want to emphasize that we are not claiming that this was an intentional effort to limit Douglas County citizens from voting, nor do we believe that our sheriff is deliberately trying to create a negative impression. However, the uncertainty surrounding the situation is why we are advocating for the establishment of some sort of rule or ordinance to protect the integrity of our elections in the future. Optics are crucial, and right now, this situation does not look good. And that's all I wanted to say is just, could we kind of take a look at this for future voting, because we're going to do it again in 2 years. So that was it. Thank you so much for your time.
All right, thank you so much. We certainly would take this matter under advisement. Okay?
Thank you. Our next individual is Rosie McGee.
Good morning.
Good
morning.
Mrs. McGee.
Thank you all for taking the time to see me today. I'm here because I need, let me digress. I've been a citizen of Douglas County for 25 years, and I have had conversations with the various departments at Douglas County as well. But I'm here today because I'm asking that the help of the commissioners to have the assessor's office held accountable or upheld the county laws. I have been biasly discriminated against with my property taxes because of one of your employees' personal issues, Eugene, personal issues against me. You say, he doesn't know you, how would he know that he has a personal issue against you? Number one is, I've asked, which is law, I've filled out timely the exemption for the S7 exemption. I have been refused that exemption. And he states that that's because you don't have your driver's license. I said, so that's state. So what I presented to him was my official federal, which supersedes state, birth certificate, certified birth certificate. He says no. So I took it. So I went a step further. I tried to go to his the head. He said, oh, he's not in. You have to deal with me or else. So in doing that, and I digress a minute, because he also pretty much called me a criminal. I'm the citizen. He works for me, supposedly. But that's one issue, one of the times that he almost calls me a criminal because he says my driver's license, that's it. So then what I did is I said, okay, so in addition to that, I'm supposed to be there's a discount that they give to citizens if you're in a subdivision. I have been denied that too by Eugene. He says, no, that's an older subdivision. But yet one of my other neighbors, he's getting it. So why is it that it's an older subdivision for me? I've been there 25 years, correct. It is older, but the bylaw states subdivision gets that discount, and he's refused that for me as well. So I've asked those couple of things. I presented the documentation to them, the federal documentation to them, which they have to him. And I tried to talk with his director, and I said, I don't want to talk with him anymore, Eugene, because I'm a citizen. For him to call me a criminal, that's a bit much. So then so I said, I don't want to talk to him anymore. So now they're saying, oh, well, you're so upset. It's not personal. I just want what's rightfully mine, my discount. That's mine. That's mine. That has nothing to do with him personal, but he has this personal issue with me, as I said. He wants to win. He wants to win over, but he's supposed to be working for us, the citizens of Douglas County. So that's why I had to, unfortunately, come to you all today to ask you all's help in resolving and holding them accountable, making him do what he's supposed to do. He tells me, he's county. He tells me, if you go back to the state, to the driver's license, they will correct whatever they have for free. So I said to this is the director getting information from him. So I said to her, he's county. How does he know what the policies are with the state? I don't understand that, because we first follow your policy, be familiar with your policy, and then you can be familiar with someone else's policy. But she's very passive in getting this resolved. She's referring me back to him, but that's the whole issue. I wanted to get away from him because he's unprofessional. And thank you today for hearing me out. And I don't know what the next step will be. Will you be contacting me, or shall I move forward with the governors, or what the next step would be? Thank you.
Thank you so much, Mrs. McGee. Certainly, we'll take this matter under advisement, and we'll hear
And I
back
have
from her.
documentation if you need that.
Yes, ma'am. Okay? Thank you. All right. Clerk, we have anyone else?
No, that was it.
All right. Board of Commissioners, we will have a presentation tomorrow for the Douglas County Film and Entertainment Office. So be prepared and ready for the presentation. Also, we will have approval of the minutes tomorrow, so please review those minutes and be prepared to approve or deny accordingly. Financial report, please be prepared to approve the September financial report tomorrow. And then, of course, we have proclamations. And clerk, will you read the 4 proclamations that we have coming forward?
Yes, ma'am. We will have a proclamation proclaiming November 3rd through 9th, 2024 as National Animal Shelter Appreciation Week. We'll have a proclamation proclaiming November 1st through November 11th, 2024 as Operation Green Light for Veterans. A proclamation proclaiming the month of October 2024 as Domestic Violence Awareness Month. And a proclamation proclaiming November 3rd, 2024 as Retired Educators Day in Douglas County.
All right. Board, we have the following as read or stated by our clerk, that proclamations that will be coming forth to us tomorrow. Public hearing, we will have Board of Commissioners, and to the citizens of this county, we will have a public hearing tomorrow morning regarding the 2025 budget. Is that correct, clerk? Okay.
Yes, ma'am.
Just want to make sure. Agenda items, we will now begin with our agenda items. Clerk, please begin with the first agenda item.
Yes, ma'am. We have grants. The number 9 is authorization to accept the fiscal year 25 Family Connections Grant Award as fiscal agent in the amount of $56,250 with no match for the period of July 1, 2024 through June 30, 2025 for Douglas Corps, and establish the budget and authorize the chairman to sign all related documents. Jill Hobson.
Good morning.
Good morning.
Each year, the county is the fiscal agent for the Georgia Family Connection Grant. Douglas Corps receives this from the state of Georgia. We are the fiscal agent, but they do the programmatic. We just do the fiscal pass-through. I'm asking that the board allow us to do this another year.
Okay. Any questions, board? Commissioner Raxton, you have the floor.
Yeah, just a quick question. It's just a matter in regards to the attachment of the FY25 GAFCP. It looks like the link is broke.
I'm sorry, I didn't.
I said it just looks like the link is broke to that particular document.
Okay, I'll check into that.
Okay, thank you. Madam Chair, I yield the floor back to you.
Okay. Any other questions, board? Okay. Thank you so much. Jill?
Okay. Number 10, authorization to accept the Georgia Department of Agriculture Dog and Cat Sterilization Grant in the amount of $2,000 with no match, establish the budget, and authorize the chairman to sign all related documents pending final legal review. Vanessa Francikowski.
Good morning, Madam Chair, Vice Chair, Board of Commissioners. This is a standard grant that we apply for every year with the Department of Agriculture. It is based on our good standing with the Department of Agriculture and with our annual reporting. We report every month along with every 6 months. We've never had any issues. This money goes directly to our spay and neuter fund. It is only for animals within the shelter. It's not for the public. We are working on that separate grant, but this is just a standard grant that we get every year from the Department of Agriculture.
Thank you so much. Board, any questions?
Just
Commissioner Raxton, you have the floor.
All right, good morning.
Good morning.
Just a quick question. I'm just curious for the $2,000 grant. Do you have an idea of how many or what's the number that can be sprayed or neutered of cats and dogs? I'm just
So
curious.
this year's grant is a lot lower. The grants in general are based off of the license plate tags. So when you get the dog and cat license plate, money goes into the Georgia Department of Agriculture.
Okay.
This year, they gave us a lot less based off of the sales. Generally, we have a fee that we propose to them, which is like $35 for male cats, $30 for female cats, things like that. In general, $2,000 right now will probably go ahead and spay or alter, I'd say 50 animals.
50. Okay.
Last year's, we got about 10,000, but again, it's based off of sales, so it's a lot less, but we are securing other funding to go ahead and help with this program.
Okay, thank you very much.
You're welcome.
Madam Chair, I yield the floor back to you.
Okay, thank you. Any other questions, board? All right, thank you, Director.
Okay, number 11, authorization to accept the delinquency prevention grant from the Criminal Justice Coordination Council, L21-8-027, in the amount of $39,960 with no match to continue the operation of Strengthening Families Program, establish the budget, and authorize the chairman to sign all related documents pending final legal review. Jamie Dappermont.
Good morning, Commissioners.
Good
How are
morning.
you?
morning.
Good morning.
So this is the delinquency prevention grant. We receive this grant on a yearly basis. This is the 5th year we've received this grant. This will be the last year of this grant funding, however. But this funding allows us to do the Strengthening Families program for our low-risk youth to try to help keep them out of further involvement in the delinquent system.
Okay, thank you. Board, any questions? I just have one for you. You said this is the last year of the grant.
Yes, ma'am.
Any particular reason why? or-
It's a federal pass-through grant, so they receive funding from the Office of Juvenile Justice and Delinquency Prevention, and it's the last year of their funding.
So this is, okay,
Yeah.
makes sense. All right, if there are no questions, thank you so much. There are no further
Okay.
questions.
Number 12, approval to accept the state and local cybersecurity grant in the amount of $68,180 with a 10% match to be funded by the Information Services budget. Establish the budget and authorize the chairman to sign all related documents pending final legal review. Alex Betancourt.
Good morning, Madam Chair, Mr. Chairman, Commissioners. This
Good
grant
morning.
is first of its kind. It's a cybersecurity grant that was issued out by the federal government. Back in 2021, it took the state a little bit to distribute the funds, but we finally were awarded. Each agency had a maximum amount that they could apply for. We applied for the maximum, and that's what we were awarded. There's a 10% match that's in our budget to fill this grant, and we were going to be utilizing it for some cybersecurity initiatives in the county.
Thank you, Director. Any questions, board?
Thank you.
Thank you.
Okay. We'll move to our business items. Number 13, authorization to approve a yearly contract with Judicial Alternatives of Georgia, Inc. for misdemeanor probation services for state court, and authorize the chairperson to sign all related documents pending final legal review. We have Judge Fortner.
Madam Chair, members of the board, thank you for
Wow.
your service and attention. Judge Barker is in court, so you have to settle for me today. We're here for our yearly visit regarding the JAG contract. JAG is the company that supervises misdemeanor probation here in state court and also in Superior Court. So it's tab 13 and 14. It's the same company. So they supervise all of our misdemeanors, and then in Superior Court, when a case is reduced to a misdemeanor, which often happens in all Superior Courts, they supervise those cases. So we have one company supervising misdemeanor probations. We've been in a process of just coming back and doing that contract on a yearly basis and adjusting terms if necessary. When we submitted it this year, legal had a couple of suggestions that we amended the contract to include. They were good suggestions. Number one was to make sure we were protecting access to any protected GCIC or NCIC information. That's information that's personal to an individual. You have to go through certain training to have access to that particular type of information. So just making sure nobody has any access to that unless they've been authorized to do that and trained. And also to change the period of service so that it continues on a yearly basis unless we come back to adjust terms or address some issues. Within the contract, it contains a provision that allows for termination within 30 days if there should be some type of problem or if JAG is not performing their services. We've not seen any problems like that. They've done a good job in every observation that we've had throughout the court process, but it does require us to address that contract every so often, and that's what we're here doing. So.
Okay, thank you so much, Judge. Any questions for Judge Ford? Okay, Commissioner Kenneth Jones, you have the floor.
With the legal amendment for the period of service, is that going to be an auto renew so that you don't have to do this process every year unless you determine that it needs to be terminated within 30 days?
It seems to be that it will automatically renew. However, there are a couple of issues that I think are not really contract issues that we have to address. For example, JAG is audited, and I think they have certain requirements that those contracts at least be reviewed every 5 years, which we'd of course be reviewing it within a 5-year period, or probably before then in case we needed to adjust terms. But the way it's written at the suggestion of legal was to make it automatically renew unless somebody terminated it or adjusted the terms, which a term adjustment would come back before the Board of Commissioners for approval. But I think it would be something that our plan would be to, at the very least, we have to take another look at it every 5 years for the purposes of the audit with JAG.
And so would there, I guess this is a question more so for legal then, because to me it makes sense to streamline it. We've been using JAG for almost a decade now.
It's one of those services that you don't change because they're currently supervising hundreds of
people.
defendants. So it is a company that unless there was a problem or some issue, I would foresee that we would be continuing to use them. But it's definitely something that would involve a term of years.
So to keep them from having to come back, Attorney Barnes, do we need to add anything that says we'll review it? If it's not come up for termination within 30 days, that we'll review it at the 5-year mark, or you're fine with it being worded the way that it is now?
So we've got to keep in mind that OCGA 366013 requires multi-year contracts to have termination at the end of either the fiscal year or the calendar year.
Okay.
And ours are the same, right? And so a majority of the time, the only other time would be IGAs where we are contracting with another governmental entity. Otherwise, we need for contracts to end at the end of the year and then automatically renew for successive years to be in compliance with that code section. Certainly, we can put something in there that says at the 5-year mark, we will reevaluate, which will require obviously some calendar time to do it before 30 days, because if
I'm not trying to add anything extra to you. I just wanted to make sure, because it makes sense that it would auto renew so that they don't have to keep coming
Absolutely.
back. So as long as you're comfortable with that, we don't need to add.
I am great with auto renewals. At the end of the year, auto renew until they determine or we do.
We're going to make sure it comes back within the audit period because it's best practices for them to do so, and it would have some consequences for JAG if they didn't do it. So we will definitely be watching that to making sure it's at least getting monitored to keep compliant with the auditing process that these private probation companies have to go through.
Thank you, Madam
There
Chair.
was one thing I did want to point out on page 8 of 15. In case it hasn't been adjusted, it looks like the period of service is set to date of execution until December 31st, 2024. We need to make sure that's been 2025. That's what was intended to be put there because we're just talking about the contract for next year, from January 1st through December 31st, 2025. I think it just was a clerical error that got included, but it's on page 8 of page 15. But all the changes that legal suggested have been incorporated in the contract.
Madam Chair, I yield back.
Okay.
And it may have been corrected already. I just wanted to make sure.
They're looking at it now. Okay.
Okay, Judge Fortner has the next item as well. It's the same agreement, but it is for Superior Court.
Right, for supervision of their cases that have been reduced to misdemeanors.
Okay. Any questions, Board? Okay. Thank you so much,
Madam
Judge.
Chair,
All
members,
right.
thank you all.
All right,
Right.
thank you.
Okay, we'll move to number 15, a resolution approving the issuance of revenue bonds in regard to the TEFRA. It's the Tax Equity and Fiscal Responsibility Act. Approval of Durley Lane Senior Residences requested by the Housing Authority of Douglas County, and authorize the chairman to sign all related documents pending final legal review. Attorney Joe Fowler is here.
Morning,
Yes.
everyone. Joe Fowler, Post Office Box 489. Allow me to introduce Mr. P.J. Hornick, who looks shockingly like Owen Wilson. He's with Southport Financial Services, and he's come up from Tampa this morning, thank you. And with him is Michael Casamillas. He's a bond lawyer with Kutak Rock in Atlanta. Last week on Tuesday, the Housing Authority adopted a resolution authorizing the issuance of revenue bonds for an entity called SP Durlane in the amount of $16,500,000 for the construction of 119 senior housing units at 8523 Durley Lane. Go left to the bottom of the hill, go up the hill. It's on the left-hand side before you get to Chick-fil-A. A total of 20% of those units will have rents calculated at 50% of the area median income. The balance will have rents calculated at 60% of the area median income. For example, the 50% AMI produces rents of $840 a month, the 60% at $1,000 a month. There'll be 63 one-bedroom, one-bath units, 56 two-bedroom, two-bathroom units. There's no project-based rental assistance. As was noted, these bonds will be tax exempt, and when a financing involves tax-exempt bonds, a hearing is required under TEFRA, the Tax Equity Fiscal Responsibility Act of 1982, requires a TEFRA hearing, and that was conducted last week before a hearing officer. No one appeared to inquire about the nature of the project. And the next step in the process is for you, the local governing body, to grant public approval to the financing through the Housing Authority. The authority made findings that this financing is in the best interest of the community, and this action is simply to ratify that determination. The bonds will never constitute an indebtedness of the authority, the county, the city, the state of Georgia. It's purely a revenue bond from the rentals that will be paid. Mr. Hornick can address other details about the project. Mr. Casamillas can address issues pertaining to the financing. That's it, Madam Chair, members of the board.
Thank you so much, Attorney Fowler. Board of Commissioners, we have any questions? Okay. All right, no questions.
Thank you very much.
Thank you. We'll move to number 16, approval of a change order with Bartow Paving Company, Inc. in the amount of $287,251 for paving services in Laurel Grove subdivision with no change to the budget, to be funded by bond reimbursements, and authorize the chairman to sign all related documents pending final legal review. Solomon Rana.
Good morning, Madam Chair, Board, and County Administration. Bartow Paving was competitively selected for our annual resurfacing this year. While that work is underway, County is responsible for paving Laurel Grove subdivision, on which we collected bond funds in 2013. All houses are complete in this subdivision, and the new developer is now requesting the county to complete our obligation of paving the roads. Bartow Paving has agreed to complete that work at the subject price and will not charge any mobilization cost. Therefore, we're requesting your approval on this change order.
Thank you so much, Director Rana. Board of Commissioners, we have any questions? Clerk?
Okay. Number 17 is approval of an MOU with the City of Douglasville for holiday signal timing and monitoring around, around the Arbor Place Mall area during the 2024 holiday season at a cost of $5,880 to be funded from the DOT department budget, $2,940 to be reimbursed by the City of Douglasville, and authorize the chairman to sign all related documents pending final legal review. Solomon Rana.
Given the increase in traffic during holiday season on three major corridors, which are State Route 5, Chapel Hill, and Douglas Boulevard, DOT performs a special assessment during this time to actively monitor and adjust traffic times or signal times for varying traffic conditions. This is done through in coordination with the city, where they're responsible for half of the cost. The price remains same as last year, and this year we'll be targeting 18 intersections on these 3 roadways. Therefore, we're recommending this for your approval. Thank you.
Thank you so much, Director. Board of Commissioners, any questions? Okay.
Okay.
Clerk?
Number 18, authorization to accept 0.05 acres of right-of-way donation from H Acquisitions LS LLC with no impact to the budget, and authorize the chairman to sign all related documents. Solomon Rana.
This is a commercial hotel development that is nearing its DRC approval. Part of their compliance with UDC requires this additional dedication of right-of-way, given the roadway classification. This comes to us at no cost, and we're requesting your approval. Thank you.
Thank you, Director. Board of Commissioners, any questions? Okay. Clerk, you have the floor.
Number 19 is approval to award
Thank
a
you.
contract to Unity Construction Company, Inc. in pursuant to ITB 24-027 Pine Label Mobile Home Park Sewer Connection Project in the amount of $687,006.84 to be funded through the ARPA State Fiscal Recovery Fund, which is the water and sewer, and authorize the chairman to sign all related documents pending final legal review. Anthony Choice.
Good morning, Madam Chair, Board of Commissioners, County Administration. Thank you so much for having me. So, Procurement Department solicited solicitations for the construction of a gravity sewer line at the Dorset Shoals Road right-of-way for the Pine Hill Mobile Home Park, and it will actually culminate at the Queensdale Drive in Douglas County. We're here today to seek your authority to authorization to approve a notice to proceed, or intent to proceed, to Unity Construction in the amount of $687,006.84, and authorize the chair to sign any documents.
Thank you so much, Director Choice. Board of Commissioners, we have any questions? Okay. Thank you.
Thank you.
Thank you. Number 20 is approval of a memorandum of understanding for 911 backup service between Douglas County 911 and Fulton County Emergency Services, and authorize the chairman to sign all related documents pending final legal review. Katrina Harley.
Good morning, Madam Chair, Vice Chair, Board of Commissioners, County Administration. Thank you for the opportunity to speak with you this morning. This is just a memorandum of understanding. Of course, you all are aware that we are in the design phase of our own new backup 911 facility, and we have to have our equipment removed from our current backup facility next month. And so we reached out to Fulton County for an ask to use their backup facility, which they have graciously agreed to do so that we can ensure that there is no service interruption or any disasters affecting our current 911 system, that we'll be able to seamlessly back that system up. Of course, this has to go also before the Fulton County Board of Commissioners, and so we're just requesting that once everything is done, that we are allowed to be able to do this to service the citizens of Douglas County.
Thank you so much, Director Harley.
Thank you.
Board of Commissioners, we have any questions? Commissioner Kenner Jones.
I just first want to acknowledge, thank you for being proactive and finding us a backup. I actually had the opportunity to tour the Fulton County Emergency Services facility and learned a pretty significant amount. We currently don't have a hot backup center for our 911 at all if we don't use this one. Is that correct?
That is correct. We do have a backup facility, but it is not considered a hot backup facility in that we don't regularly use it. However, with our new backup facility that will be built, it will be a hot backup facility used all the time.
Because it's my understanding if we didn't have this one, it would take an hour or more to set up our backup center in
Yes.
its current iteration.
That is correct.
Well, I just thank you for looking into that and making sure that our residents are safe, because I don't think that that's something that the residents were aware of. And so I appreciate your work on this, Director Harley.
Thank
I
you.
yield back, Madam Chair.
Okay. Thank you so much, Commissioner Kenner Jones. Any other questions? All right, Vice Chair, you look like you want to say something.
No, I'm just grinning. She knows that I think the world of her. She does a great job over our 911 center, and I really think that we could not have a better person in that position.
Mhm.
And we appreciate all that you do.
Thank you.
Director, if you could just prepare us, at least manage our expectations. I believe you said we will utilize Fulton County a year, right? How long did you say we will have to utilize their services until ours is fully operational? Can you share that with the board?
Yes, so right now, we just had a meeting with the construction company on Thursday. And so right now, ours is scheduled to break ground January with completion in December. However, the memorandum of understanding with Fulton County can renew up to 5 years with the opportunity for us to also serve as a secondary backup for them. Right now, the city of Atlanta is their primary backup, but we are close enough with Fulton County that we can also serve as their backup, and they continue to serve as ours. It never hurts to back up the backup.
Mm-hmm. Okay. If there are no further questions, Clerk, you have the floor.
Okay.
Thank you so much.
Thank you.
Director. Thank you.
Number 21, approval of a memorandum of understanding with the Nichols Center to delineate donated services provided to first responders to include mental health resiliency training, first responder mental health training, first responder counseling, and crisis response education and wellness training at no cost, and authorize the chairman to sign all related documents pending final legal review. Chief Allen.
Good morning,
Good
Madam
morning.
Chair, Vice Chair, Board of Commissioners, County Administration. We're requesting approval for this MOU with the Nichols Center to provide services for our first responders for those services that was spoke upon: mental health resiliency training, first responder mental health training, counseling. As we all know, that our men and women experience a lot of traumatic things in the department, and so this helps provide an outlet for them to deal with these things and to move on and continue the job that we normally do. So that's what we're looking for with this particular agenda item.
Thank you so much, Fire Chief. Any questions, board? Vice Chair?
Yeah, just real quick, Chief, because I know the Nichols Center also was a great support when our deputy got shot. That also assisted our 911 operators as well. So is this just going to be limited to the fire department, or will this also be to 911 or any other department?
I would like for it to reach out to 911 also. I mean, so we're just looking at all of public safety if we can allow that to happen.
Okay, all right. I yield back, Madam Chair.
Thank you so much, Vice Chair Alvarez. Any other questions, board? Commissioner Martin Braxton, you have the floor.
Thank you, Madam Chair. So I just want to, again, just from a comment standpoint, this is great, and I'm so glad to see this occurring. As the Vice Chair has indicated, if there's opportunity to expand this throughout other county services, other county departments, I think this would be great. So I would just ask that whatever we need to do to help speed that or to get that process moving, that we pursue that. Madam Chair, I yield the floor back to you.
Okay. When you led my mind to thinking another direction, so when will the project go live?
Yeah, as soon as we go through the legal review and process.
Oh, okay.
Yes, ma'am.
Sounds great. All right. Thank you.
Thank you.
Clerk, you have the floor.
Okay. Number 22 is approval of a mobile integrated health program that focuses on reducing high EMS utilization and aligning caller needs to appropriate services at an annual cost of $250,000 funded by the fire department's budget, and authorize the chairman to sign all related documents pending final legal review. Chief Allen.
I'm going to let my subject matter expert here, Chief Stacy Farber, go ahead and speak on this one.
This is very near and dear to my heart. We have a large percentage of the population that is attempting to age in place. There are now such things as hospital and home, And so there is a portion of our community that is attempting to do these things without having the resources that they need in order to be successful. So mobile integrated healthcare, it targets 10 different components: falls, mobility, vulnerable adults, the aging in place, unsafe living conditions. And it does everything from connect them to services to make sure that they have access to those services and that there's follow through. So it's a program that's not throughout the nation, but it's becoming a standard, and it's making sure that 911 is able to meet the needs when people call 911. So that is mobile integrated healthcare in a nutshell. One of the biggest parts of this is substance abuse and mental health 1013 access, and we have a large percentage of our population that experience those two subcategories. And for that, we have to have clinical oversight of that type of program. And so we are looking at bringing in a subcontractor, which is Tara Nichols, who would be able to manage this program for us from a clinical perspective for the behavioral health and substance abuse needs, as well as get us access to 1013 services. We have that now through 988, but sometimes it's a 4-hour wait to get them on site, and so there's just barriers to that with 911 service. So the total cost annually is $250,000. That's broken up over 2 full-time MIH specialists, a vehicle for them to share, and our clinical case manager subcontractor position of $75,000 annually.
Thank you so much, Chief. Any questions, Board?
Yes, Madam Chair.
No, he can go first.
Vice Chairman Alcarez. I feel like a little Bob.
Oh, that's okay. Okay, so we've been working on this for some time now.
Yes.
A lot of effort and thought's been put into this program. I thank you guys for working with me and us going back and forth in regards to ideas. I'm just going to lay some things out here, some questions to you, so that the public understands what this is going, how this is going to benefit our county. So, how many would you say or estimate calls that are sent with ambulances out this is going to save from us having to send an ambulance out to a particular call?
When we look at our high utilizers, we look at patients that are trying to, age in place, those type of things. They may call 911 30 times a month. And so those patients become case managed. They meet with Shay or whoever the other individual would be, and she gets them the resources that they need. So you could be talking 20% decrease by the time you add in all of the components and get them the actual services that they need.
So 20% decrease on our already overstrained
Yep.
ambulance calls.
Yep.
So that's huge savings to the county, and all that, more safety for our individuals. You mentioned other counties that are doing this. Cobb, I know we talked about Cobb, and what other counties are already ahead of us on this program?
Oh gosh, Cobb is for sure, Coweta. Most of your metro Atlanta, Grady has a component of MIH. Some of them will call them community paramedicine. It's the same type of program. Clayton has a really robust program. Gwinnett County does. So it's a lot of your more established, more progressive counties have these type of programs.
Okay. And I know we talked about safety measures for these employees going out, because we are talking these calls sometimes are for some of those mental calls. So we want to make sure that we protect those who go out on these calls. So I'm not going to disclose that, to the public, but we have put safety measures in place to where if one of those are in need of assistance from law enforcement, simple things, we've got that in place to protect them. Simple things can be done to where they're on the way very soon.
Yes, 100%.
All right, then now let's go back to looking at this, because it's very important to me, because the county, we as the Board of Commissioners kind of got hit a little bit from some of our public in regards to taking away some of the funds to CSB. But where we were looking at with this, and County Administrator, I'm going to ask you to clarify this to me, but we were allocating around $600,000 for this program through CSB. Am I correct?
Correct.
All right, so we allotted that for them. So bringing this back in the house to where we're not going through a middle person to be working with our fire department, we thought it was very important to get this program under our fire department. So our fire department actually takes us on and heads this program up, has oversight onto it. So we were able to bring that back to the county and under the fire department, with a reduction from $600,000 to $250,000.
Yep, 250.
And this is with full-time employees in the fire department, 2 employees and plus a subcontractor from Nichols Center. So to us, that was huge. I know that I have lingered with a little bit of this because I just wanted to make sure that when we did it right. And you guys have done a great job putting this together, and I greatly appreciate it. And with that being said, Madam Chair, I think I'm done.
Okay, thank you so much, Vice Chair. Commissioner Kenneth Jones, you have the floor.
I just want to say thank you. It means a lot to me to know that the seniors in this area, most people at this point know my mom lives here also, but you all are creating a program that will truly allow people to age in place with dignity. I feel like that's a service that has often been overlooked from a public safety and a public health perspective. And so I just appreciate your work on this. Chief, you need to bring your ringer every time. She always does a wonderful job, so thank you. Appreciate it.
Thank you.
And certainly this drills down on the efficiency of triaging. And, you know, we talk about that quite often, and so that really warms my heart that we're moving in this direction because time is tissue. We talked about that. All right, any other remarks, board? Thank you all. Clerk, you have the floor.
Yes. Number 23 is approval to adjust the EMS fee schedule to the following. BLS transport fee from $589 to $767. ALS-1 from $713 to $929. ALS-2 from $877 to $1,152, and to include a response fee of $100 for patients that receive EMS assessment or treatment without transport. Chief Allen.
At the request of Commissioner Kenneth Jones, I'll allow Chief Farmer to go ahead and speak on this.
Smart man, smart man.
Not something that we like to do, but something that we need to do. Medicine is expensive, and so, you know, every year the prices increase. 2 years ago when I took the EMS chief position, and looking at where we were with our rates, we were 40 to 80% below the regional average. And so we did a 10% increase last year, just because of the increase in the cost of medicine. We really need to look at a 30% across the board. One of the things that Commissioner Alcaraz really wanted to make sure was that we were cognizant of our senior population, and so we did specifically drill down into what that would look like. A 30% across the board increase sounds like a lot, but for your Medicare recipient, you would be looking at an increase of $35 to $53. So it's a 30%, but we did actually look at what that would mean, real dollars for our aging population. The response fee is something new that we need to add. We have about a 34% non-transport where we treat on scene, and right now we don't have a mechanism, so we may give them glucagon that costs $200, and we can't recoup any of that because we can't bill. Some of this is covered by private insurance. Some of your bigger players, Cigna, Anthem, will cover it, but some of them will not, so this may be a self-pay type of situation. However, the number of times people usually require 911 services is, 1 or 2 times in their lifetime. And for us to be able to continue the services, then we felt that that was necessary in order to make sure that we're making adjustments. So.
Okay. Any questions, board? Commissioner Raxton, you have the floor.
All right, thank you. So thank you for bringing that information, because I was going to ask what was the main driver for the uptick as far as the price and the 30% there. When was the last time that we did a price adjustment, just from a historical standpoint?
July of last year.
Okay.
And then before then, it had been almost a decade.
Almost a decade, okay.
Yes, sir.
And do we think the 30% is a pretty solid, or do we think that potentially next year we would also maybe need to do another increase? I
would not be surprised if we come back and ask for another increase. We're still right at 30% below, so we're not even, I don't want to say competitive, because that's not our goal, being having a tax base, but to be able to be where we need to be to make sure that we're collecting enough for the expense. We're still kind of under where we need to be honest.
Okay. All right, Madam Chair, I yield the floor back to you. Thank you.
Okay. Any other questions, board? Vice Chair, you have the floor.
Okay, so just real quick, just so that our public understands, what warrants a BLS, and explain all those terms so our public understands what this is for, a BLS, an ALS, and ALS2.
BLS 1 is where it's an EMT assessment, so they may do a head-to-toe trauma assessment, but it doesn't require any advanced procedures or advanced assessments such as a 12-lead cardiac monitor. ALS 1 is going to require an advanced assessment or an advanced treatment, but only 1 up to 3. If you get more than 3 advanced procedures, then they consider it an ALS 2. Those are typically, we don't have, most of them are ALS calls, but ALS 2 is your cardiac arrest, your very high acuity patients that require a lot of advanced treatment.
Okay. The only other thing that I know Commissioner Mitchell and I were in a public safety committee meeting, we were talking about this $100 fee. There's just a couple, I understand we probably just need to make that real clear what that charge is going to be for that $100, because that can seem kind of vague. You know, it seems like it's very broad. If it's somebody who is abusing the calls, I can clearly understand. But also, my concern is our taxpayers going to say, we already pay taxes for this service. Why aren't we being charged $100 to utilize this when we're paying taxes? So that concerns me a little bit. I say, let's, if we can, I have no problem with the 30% adjustment, but I would say I would like for us to maybe look at removing the $100 fee just for now till maybe our next meeting, and make sure that we specify clearly what that charge is going to be and who's it going to be for.
Okay.
I'll yield back, Madam Chair.
Okay. Any other questions, Board? I just have one for you regarding the ICD 910. You know, that's the billing component. Is it reimbursable? When I say that, when you bill, will that take the pressure off our citizens? I'm just wondering, when you bill
For
their insurance, Medicare, Medicaid, and private insurance, and you mentioned it briefly, you touched on this, I don't want to be redundant, but if you could just explain that portion as well.
they'll put in the ICD-10 codes, but Medicare, for example, will only pay if you transport. And so that leaves, you know, for patients that we're providing treatment but non-transport in residence, such as D10 or glucagon.
Right.
Sometimes we'll even do cardiac arrest resuscitation in home and not transport. And in those instances, you know, you're talking $500 or $600. That's because you don't transport, you can't bill the insurance.
You cannot?
Cannot. So some of the big players, Cigna, Anthem, they do allow it, but others don't. And CMS Medicare does not.
Okay. Thank you for clarifying. All right.
Thank you.
Thank you all. Clerk, you have the floor.
The next item is authorization for the chairman to execute an annual agreement with Douglas County Travel and Tourism, Inc., pending final legal review. Tiffany Stewart Stanley.
Good morning, Board of Commissioners, Madam Chair, County Administrator. So we are before you today to get approval of the 2024 annual agreement with the Douglas County Travel and Tourism, Inc., which is our destination marketing services. This agreement would allocate 43.75% of our current hotel motel tax to DCTT for this year. As of right now, the numbers through August indicate that we would be allocating a proposed $532,598 for this agreement. I will yield for any questions.
Any questions, Board? Thank you so much, Chief of Staff. Any questions?
Is there a contract? I was just considering about.
Okay.
Just ask about
Commissioner
the contract.
Raxton, you have
go
the
ahead.
floor.
Yeah, I'm just curious, is there a contract or just something?
Yes.
Just documented, just kind of written
Yes. You all, I don't know if you should have received that over the weekend.
out? Oh, the week.
If not, I can make sure we go over a copy with you
Okay.
after this meeting.
Okay.
Okay. Any other questions, Board? Okay. If not, I yield back to you, Clerk. Is that it for us?
Okay. Yes, ma'am. We have discussion items, which is board appointments, but those will be discussed in executive session.
Okay. Board of Commissioners, we've arrived at the point where if you have comments, this is a time for you to speak if you have any comments. Okay. Attorney.
Yes, we do have executive session matters. We have multiple legal items and one real estate.
All right. Board of Commissioners, do we have a motion to go into executive session?
Madam Chair, I make a motion to go into executive session for legal and real estate matters.
Madam Chair, I second the motion.
Okay, we have a motion and a second on the floor. Any discussion, board? We have a motion and a second. Please indicate by raising your right hand. We have a 4-0 unanimous vote, and the motion carries to go into executive session. And at this time, clerk, I'm going to adjourn the meeting so we can go upstairs. Is that?
Yes, we won't adjourn this meeting yet. We'll go upstairs and then we'll come back and adjourn.
We're going to come back. Okay, all right. Well, we're going into executive session, and citizens, we will be leaving this room momentarily to conduct our executive session, and we will return so I could close the meeting out. Thank you.